So it gives me great pleasure to introduce Congresswoman Lucille Roybal-Allard from the 34th District of California. She's been a champion for healthcare. She's the chairperson of the Congressional Hispanic Caucus Health Task Force, and she has a lot of words of wisdom to tell us today. I'm not going to read her bio, it's in your program, but we're very happy that she was here today. Congresswoman?
Thank you very much. It's actually my pleasure to be here to welcome you to this briefing on healthcare reform implementation for our Hispanic communities. And I want to thank the National Hispanic Medical Association and Dr. Elena Rios for convening today's panel of experts. You know, throughout the healthcare reform debate, NHMA was for me and for my staff an invaluable resource on the legislative fixes that we needed to have in order to strengthen the health service delivery to our Hispanic communities. Some of you may recall that last summer, when Congress began the process of starting the health reform legislation, as chair of the Congressional Hispanic Caucus on Health Task Force, I brought together Hispanic health leaders from across the nation to discuss the health concerns and the very specific issues our Latino communities faced in accessing culturally and linguistically competent health care. It really was a very dynamic meeting, and we had all the various groups that make up the Latino population present. And by that I mean we had Mexican Americans, we had Puerto Ricans, we had Cubans, the whole gamut of people who represented the Latino community. And as a result, that meeting was the impetus for a summary paper that helped to guide the Hispanic Caucus in our advocacy for creating a diverse and culturally competent healthcare workforce and expanding access to quality healthcare for all our minority communities. And it was due to the support of NHMA and these other Latino health experts and advocates that we succeeded in that effort. And it was the expertise, the experiences, and the passion and participation of all these groups working together in partnership with the Congressional Hispanic Caucus that helped fuel our perseverance to successfully drive health reform forward, even in times when we thought it wasn't going to happen. But the passage of healthcare reform, it's important to note, marks the beginning, not the end, of your involvement and our efforts to bring quality and culturally appropriate access and affordability to our healthcare system. So today's discussion on the implementation of healthcare reform implementation is very timely because, as you know, we are beginning that process now. The rules and regulations are being drafted, and it is critical that the Hispanic health leaders, and those of you, I see staff in the audience, you're the backbone for those of us who are members of Congress. We depend heavily on the work that you do, so I'm very happy that I do see so many staff people here as well. But it is important that we all work together and remain vigilant to ensure that the implementation of each part of this historic law meets the objectives that we have all fought so hard to obtain. So towards that end, the administration and this Congress must continue to hear the voices of our Hispanic communities and our allies. The participation of Nora Super, who represents AARP, is very welcome. As you know, we have a large Latino population, and we need to make sure that their issues are addressed. ARP is a true ally and champion in helping us to make sure that that happens. And I also want to acknowledge the importance of the participation of Dr. Garth Graham from the Office of Minority Health and Dr. Janet Heinrich from HRSA, who is from the administration. And the fact that they are here speaks to the very strong commitment of President Obama and his administration to ensure that the long-awaited promise of equal access to culturally and linguistically competent health care in our Hispanic communities does in fact become a reality. So I welcome you and I thank you sincerely for being here. So with our goals in mind, we know what it is that we want to accomplish today. I again want to welcome all of you to this briefing and to thank you for taking the time. And it's a very busy time right now, as you know, even though it seems like sometimes we do a lot of waiting for, that other body on the other side. But nevertheless, it's been a very busy time. There's a lot of work that the House is still doing. So I want to thank those of you who are here from my colleagues' offices for being here, and all the other folks in the audience who believe very strongly in what we're trying to do when it comes to health care reform. So I know that you're going to find today's discussion both informative and compelling, and I encourage you to make it lively by asking questions, challenging our panel if need be, because we all have that common goal in mind of making sure that health reform legislation, the bill that we pass, does in fact meet the objectives for all Americans, and in our case, most certainly our Latino communities of this country. So thank you again for being here. Thank you to the panelists. And I will now turn it over to Dr. Reeves.